Things to avoid in the first trimester of pregnancy. Doctor's advice. The first trimester is a crucial stage in fetal development. During this period, vital organs such as the heart, brain, lungs, and nervous system begin to form. Expecting mothers must be mindful of their lifestyle, diet, and environmental factors that may affect pregnancy. Here are some things to avoid in the first trimester, based on scientific research and medical advice. 1. Avoid stress and mental pressure. Prolonged stress can negatively impact the baby, increasing the risk of miscarriage, premature birth, or developmental issues. Studies suggest that high cortisol levels, the stress hormone, can affect fetal brain formation. Advice: practice relaxation techniques such as yoga, meditation, listening to calming music, or talking to loved ones to maintain a positive mindset. 2. Avoid heavy lifting and strenuous exercise. During the first trimester, the embryo is still small and not firmly attached to the uterus. Engaging in intense physical activities may increase the risk of miscarriage or placental detachment. Advice: avoid running, jumping, or lifting heavy objects. Opt for light exercises such as walking or gentle stretching. 3. Avoid hot baths and saunas. Hot baths or steam rooms can raise body temperature, which may negatively affect fetal development. Studies indicate that prolonged exposure to temperatures above 39 degrees Celsius, 102 degrees Fahrenheit, may increase the risk of birth defects. Advice: stick to warm baths around 37 degrees Celsius, 98.6 degrees Fahrenheit, and avoid prolonged soaking. 4. Avoid raw or undercooked foods. Raw or undercooked foods may contain harmful bacteria or parasites like Listeria, Salmonella, and Toxoplasma, which can pose severe risks to both mother and baby. Advice: eat fully cooked meals and avoid sushi, raw meat, raw seafood, undercooked eggs, and unpasteurized dairy. 5. Avoid alcohol, caffeine, and smoking. Alcohol can cause fetal alcohol syndrome, FAS, leading to intellectual and physical disabilities. Smoking increases the risk of miscarriage, premature birth, and low birth weight. Caffeine, consuming more than 200 milligrams of caffeine per day, about 1 to 2 cups of coffee, may increase the risk of miscarriage. Advice: replace coffee with milk, fruit juices, or water to stay hydrated. 6. Avoid over-the-counter medications. Certain medications can impact fetal development, especially in the early stages when organs are forming. Advice: do not take any medication without a doctor's prescription, including painkillers, antibiotics, or supplements. 7. Avoid exposure to harmful chemicals. Exposure to chemicals such as paint, pesticides, and strong cleaning products may affect fetal growth. Advice: if you must use chemicals, wear protective gear and ensure good ventilation. 8. Limit air travel. Although flying is not strictly prohibited, expectant mothers with high-risk pregnancies, such as those with a history of miscarriage or high blood pressure, should avoid air travel in the first trimester due to potential pressure changes and blood clot risks. Advice: consult your doctor before booking a flight. 9. Avoid sexual activity if at high risk. Sexual intercourse is generally safe during pregnancy, but if you have a history of miscarriage, vaginal bleeding, or unusual abdominal pain, it is best to abstain in the first trimester. Advice: consult your doctor to assess your individual situation. Conclusion: the first trimester is a critical time for fetal development. Avoiding risk factors and maintaining a healthy lifestyle will ensure a safer pregnancy. Regular prenatal checkups, a well-balanced diet, and a positive mindset will support both mother and baby's well-being. If you experience severe abdominal pain, heavy bleeding, dizziness, or excessive nausea, seek medical attention immediately.